Hello and welcome to the Oral Health channel. I'm your friendly neighborhood dentist Dr. Rudra Mohan, and today we're going to be talking about oral lichen planus. Let's start. So today we are going to be talking about oral lichen planus, a mucocutaneous condition that is basically an autoimmune condition characterized by burning sensation of the mouth, and it can cause other symptoms as well, which are manifested over your dermal portions of the body, that means the skin and other areas. So lichen planus is a very fairly common condition which actually happens as an autoimmune response towards your own body, and it happens in middle-aged adults and mostly women. There is a definite association of lichen planus with psychological stress. So lichen planus manifests as different forms, as in you have the most common reticular, then you have erosive, atrophic, bullous, and basically the most common complaint is burning sensation. The typical finding that we see as dentists in lichen planus, especially the reticular form, is the presence of Wickham Striae. Wickham Striae are basically papilla lines. These are white lines that we can see intersecting each other, and this is a very typical presentation of lichen planus. However, the diagnosis is always established with the help of histopathological examination, that is by taking a biopsy of that area along with the surrounding area and seeing it under the microscope. So patients typically complain of burning sensation in the mouth, and it cannot just be limited to spicy food or salty food. It can definitely happen with just bland food that can lead to a compromise in the quality of life because people are not able to consume food. So all you need to do is, if you're having something like this, a burning sensation in the mouth, let me remind you that there are a lot of conditions, oral conditions, where you have burning sensation in the mouth. The doctor can see you, and after taking a very detailed history and seeing the presence of Wickham Striae or any other features, as long as you're doing the biopsy as well, confirmed by the biopsy, it is not necessary that if you're having burning sensation in the mouth that it is lichen planus. But then again, it is generally bilateral. That means you can see it on both sides. It's very centralized and evenly distributed. And what basically the treatment line is very simple. We start off with topical corticosteroids, and if those that line of treatment does not help in the resolution of the symptoms, then we basically go for systemic corticosteroids. Sometimes Tacrolimus is also considered as more potent and effective, and thereby we give you other nutritional supplements such as retinoids and lycopenes. At the same time, go for ultraviolet therapy. So that depends from case to case. When it comes to the malignant potential of lichen planus, it is a little controversial. The atrophic type has been found to be associated with the cancer formation, but mostly lichen planus does not turn into cancer, so that is one thing that you don't need to be worried about. But at the same time, in the same breath, if you're having any sort of oral abusive habits, please quit the habits. That's very important. And basically we use a wait and watch approach for this kind of condition, where we see how you are responding, how well you're responding to the medication, and we go further along the line of treatment if you don't respond with the initial line or the empirical line of treatment. So this was today's episode. Please like, share and subscribe, and don't forget to click the bell icon for important updates. If you want to do a WhatsApp consultation, my number is being flashed. Mind you, I might not be available all the time to take a call, so it's better you message me prior so that we can have a conversation and we can probably get rid of your apprehension or query. So this was today's episode. Like, share and subscribe. Thank you.